Hi, it's Claire from Cluesy. Thank you so much for tuning into my frequency today. I just wanted to quickly just touch on surgery and why, because sometimes when you meet with a surgeon, they tell you about what they're going to do. You either don't remember because, as you got overwhelmed with information, or they're not very good at explaining things, or whatever. That these are the things that you consent for, and why everything is so painful, and why you have what they call adhesions, so scar tissue. This is especially for abdominal surgeries, but this can go for knees, hips, shoulders, anything, because to get to where they need to operate on, there are so many layers, so many blood vessels, so many, fascia. I'm going to show you on my little anatomy app here how many layers the human body has. So when you're having surgery, how many layers they need to cut away. And you can imagine a little surgical knife does a tiny, tiny, tiny little cut. What do they have to do then to get to where they're going? Retract it. So just want to show you my little dude here for because this is going to go on Facebook. They don't like nudity, so that's why I've chopped him off here. But I just want to say this is what we look like. This is us with our skin on. If I take our skin off, we have a layer of subcutaneous fat. That's why we look yellow. Then we take that away. There we are with, you can just see, hopefully you can see there's a little white sort of, that's fascia, connective tissue. So we take that down, we're left with muscles. So just imagine you're having your gallbladder out. And I know that they do these things with the little cameras, but you still have 5 puncture sites. They still blow you up with gas. There's still a lot of stuff that goes on in there. So this is the muscles. So where's the muscles here? How many layers of muscles? 1, 2, 3, 4, 5. 5 just to get to, and then of course everything's wrapped up in other layers. So over the gut, there's a thing called the omentum. We can get rid of that. And then you've left with your bowel. And there's 35 meters of that. So if they're having to move any of that around, if we get rid of there's a lot in there. And if I get rid of all the organs and the digestive system and everything, you'll see how many blood vessels, lymphatic vessels, nerves, and everything exists in the body. Look at that. It's a mess in there. So that's why, you have lots of risk of complications after surgery and things like that, because there's a lot going on in the human body. Even, for example, a shoulder operation, without even having the muscles and the tendons and everything on there. Look how many, the blue are veins, the red are arteries, the yellow are nerves, the green are lymphatic vessels. So you can see, so if you're having a rotator cuff repair, which is in this area here, or a cleanup of a bicep tendon, look at how close. So every time you have an operation, you actually create more scar tissue. So if I can get rid of this little panel. Anyway, you get the point. It's a sensitive app and I'm not really looking at it properly. So you can see why, after surgery, you can have a lot of complications, and then what happens then? They recommend more surgery and more surgery. So it's really important to do your exercises and everything when you're allowed to after operations. It's really good to get some scar work done. Now, I will talk about scars another time, because what you see on the skin is just the tip of an iceberg, but I want to talk about that in another video. I just want, in surgeries, they're quite barbaric. In orthopedic surgery, so anything to do with bones, knee, having a knee replacement or a ligament repair or anything like that, they have power tools. They use drills, hammers, saws. In my experience as nursing, I've never seen not a big, strong orthopedic surgeon. They're not weaklings, and then the positions they get you in, and when you're under an anesthetic, all your muscles have been disengaged by using drugs. So they put you in weird and wonderful places that even your yoga teacher would struggle with. So, surgery is necessary In most cases, I would say, I don't want to say don't have surgery, but before you undertake surgery, do everything else that you possibly can first. There are so many things out there that you can do to avoid going under the knife. So if you want to give me a call or shoot me an email or send us a message, just to have a discussion about what's going on. I have a lot of experience. I'm a surgical nurse. I have been for over 20 years, and these discs behind me have saved a lot of people from going under the knife. So anyway, give us a call. Have a great week. Bye.